Let us now talk about olfaction. Olfaction is a diagnostic method applies to the breath, sweat, sputum and saliva, nasal discharge, urine and feces, vaginal discharge, and the odor of the patient's sick room. The following are three very common types of abnormal odors. First is fetid odor. This suggests an illness due to the strength of the disease evil, usually heat or dampness heat. If the odor comes from the mouth or vomitus, it is mostly due to heat in the stomach. If the odor emanates from the body, consider the possibility of gangrene. If it comes from the feces, accompanied by abdominal pain and a rapid pulse, it is due to dampness heat in the large intestine moving downward. In a woman, if the odor comes from vaginal discharge that is yellow-green with red streaks, it is uterine putrefaction. This is often seen in cancer of the uterus. The next is fish stench odor. The fish stench odor is usually found in internal abscesses and illnesses of cold dampness and deficiency cold. Bloody and purulent sputum with fish stench odor is due to lung abscess. Vomitus with blood and pus and fish stench odor is due to stomach abscess. Loose feces with fish stench odor are due to deficiency cold of the spleen and the stomach. Vaginal discharge with a fish stench odor that contains much white curds is due to downward flow of cold dampness. And third is specific odors. In certain illnesses, patients may emit certain specific odors. Appreciation of such odors assists in their diagnosis. For example, a rotten apple odor in the patient's mouth or body is a characteristic of diabetes. A urine-like body odor indicates interior attack by water qi or severe water retention. This is a danger sign of imminent collapse of qi of the visceral organs and especially common in loss of kidney functions and uremia. An odor of alcohol in the mouth and nose is usually due to indulgence in alcohol or internal accumulation of dampness heat. An odor of blood in the sick room indicates that the patient has had massive blood loss such as hemoptysis, hematemesis, hematochezia, and postpartum hemorrhage. Thank you so much for your attention.